Dr.Nwamu-Laguerre, also known as Dr. Nwamu, known as Dr. Laguerre, known as Ndiva Doc. I am so glad to see you guys here, and I'm honored that you guys came out to share this day with me. This is our 7th annual Pink Party event. Yes, thank you. This is our 7th annual Pink Party fundraiser. The event that I'm doing every year was really started by my younger brother, who I lost last year. He was in his 30s. He was doing the breast cancer awareness event every year. And so I'm doing this. I've always done it with him, but I'm carrying on his legacy in continuing to honor the people that have survived breast cancer, and just keep hope and being in the fight together. So we have a very special event planned today. We have a very lovely speaker as well. I did want to just go through some facts about breast cancer. I know we all hear about it, and some of us have been affected by the disease, losing loved ones or having survivors in our family. But I do want to just talk about some of the statistics, if you don't mind. So unfortunately, the slideshow was not projecting to the monitor, so I'm just going to do it from my computer. Breast cancer is the second most common cancer after skin cancer, but it's also the second leading cause of cancer death after lung cancer. So if we talk about some of the new cases, invasive breast cancer in women is up to 278 million worldwide. There's different type of cancers. Carcinoma in situ is at 54,000 new cases per year. Invasive breast cancer in men is up to 2,700. And the deaths for women, 43,000, while the deaths in men are 530. The 5-year relative survival rate for localized stages is 99%. So localized cancer means that it's on one side of the breast, not both breasts, and not spread all over the body. So we call that localized. So the 5-year survival rate, if it's local, caught early enough, is 99%. The 5-year relative survival rate for all stages combined is 90%. Therefore, early detection is important. So we can do things to treat this disease if caught early. We still treat late cases, but they're more difficult to survive. So there are several types of breast cancer. You'll hear so many different types, but I'm just going to run the list. If you have any questions about any specific one, just let me know. So there's ductal cancer, ductal carcinoma in situ, meaning that it hasn't spread past the epithelial cells, it's still kind of localized. Invasive ductal carcinoma, invasive lobular carcinoma, you'll see them call that ILC, triple negative. There's inflammatory breast cancer, Paget's disease, angiosarcoma, and Floyd's tumor. So risk factors, what makes people at risk to having breast cancer? So both men and women can develop this disease, but being born female is a risk factor. The risk factors increase with age and are most commonly found in women over the age of 55. Breast cancer is higher in women with personal history, either they've had it or a family history of the disease. And 5 to 10% of breast cancers are caused by genetic mutations. I don't know if anyone's heard of BRCA1 and BRCA2. Those are gene mutations that are inherited and are they put you at high risk for breast cancer. Having a first-degree relative with breast cancer increases your risk. So your parents or one of their siblings having the disease puts you at a higher risk. Previous history, like I mentioned, of cancer puts you at higher risk. So some other risk factors, a little bit softer risk factors, are dense breast tissue, using postmenopausal hormone therapy, estrogens, progesterone, certain types of birth control. Also, a known fact that puts you at higher risk is not having any children, not breastfeeding, or having children after the age of 30. These are risk factors for breast cancer. Physical inactivity, and drinking alcohol. in large quantities, obviously. So screening and detection. The American Cancer Society recommends the following guidelines for early detection of breast cancer. So they have it all in different lines, but to summarize it, anyone over the age of 40 years of age should be getting breast cancer screening through mammography. Signs and symptoms. The most common physical sign and symptom of breast cancer is obviously having a new lump. Painless usually. Lumps under the armpits are also suspicious. Those are the axillary nodes, your armpit nodes. Other signs are breast pain, heaviness, discharge, swelling, dimpling of the skin or retraction of the nipple. These persistent changes definitely need to be evaluated by a physician. Now, on your cards on the desk, there's the breast cancer flyer. On the back of